Hi there, my name is Lisette and I'm one of the therapists that works with InReach, and today we're going to talk about hand therapy. What is it and which patients can benefit from seeing a hand therapist? So in case you weren't aware, InReach was established in 2018 with the goal of providing high quality physiotherapy services using video conferencing to individuals in remote and rural communities, and to people who prefer not to leave the comfort of their home. Even now in 2022, I've had a few clients who are based from Vancouver who are not yet comfortable with going into a clinic setting. So a little bit about me. I'm originally from Victoria, but now based in Vancouver. I actually first wanted to work in pediatrics, but after I had my hand therapy placement in Victoria, it kind of shined a light on this area of orthopedics that we didn't really touch on a ton while we were in school. So I've since developed a special interest for upper extremity conditions and obtained my certified hand therapy designation in 2019. I treat a variety of upper and lower extremity injuries, including acute orthopedic trauma, post-operative and acquired conditions, so osteo and inflammatory arthritis. I primarily work at a Vancouver General Hospital, or VGH, where the outpatient team typically treats patients who have sustained orthopedic or hand injuries. My hand therapy skills include wound care, fabrication of custom splints, manual therapy, and exercise prescription. So what are we going to go over today is going to be about a 12 to 15 minute presentation on what a hand therapist is, what conditions do we commonly treat, and how can virtual hand therapy help, as well as a little case study that I'll present at the end. A certified hand therapist, or CHT, is an occupational therapist or physiotherapist who has successfully passed the written hand therapy exam, as well as accumulated 4,000 hours of upper extremities, so shoulder, elbow, wrist, or hand therapy practice. Every CHT is required to recertify every 5 years and have completed 80 hours of continued professional development in that time, and does their certification and licensing exam through the HTCC, which is the Hand Therapy Certification Commission. This is any therapist in the US or Canada that wants to be a hand therapist. So for the past 10 years, the passing rates through the HTCC has on average been about 59%. So hand therapists work closely with plastic hand surgeons and sometimes orthopedic surgeons to treat their acute hand patients, either conservatively or after surgery. Our scope of practice includes wound care, swelling and scar management, fabrication of custom splints, exercise prescription, and manual therapy. In the top picture, we have a patient who is post-surgery from a carpal tunnel release, where I would typically recommend gentle range of motion of the wrist, hand, and fingers, scar management in the form of massage, and some sort of silicone product given to them after their incision heals. Someone typically seen after a carpal tunnel surgery doesn't typically need much intervention, but there are cases where we see clients who are reluctant to move after surgery, or who did too much after surgery that they created a lot of post-op swelling. That didn't have to be the case if they had the proper education in the first place. In the picture on the right, for someone with a finger fracture or post-Dupuytren surgery, there's something called Coban, which is an elastic bandage, just like an isotoner glove that can help with swelling management, kind of like a compression sock, and a patient would wear that all the time to manage their swelling. In part 2, we talk about what conditions do hand therapists typically treat. Usually a hand therapist could treat and see a patient even on the first day that they have surgery. Depending on the surgeon, the injury, or the protocol for that given injury, or we could see someone after they've been immobilized in a plaster slab or in a cast and switch them to a custom splint. The benefit of having a custom splint is that it's lighter, it's more breathable, it's removable, and it can be changed if their swelling changes. So what I would say is that there are some conditions that I generally see at Vancouver General Hospital, like tendon repairs, nerve repairs and transfers, fractures in the wrist, hand, fingers, or crush or amputation injuries. Where this changes in the telehealth setting that I've noticed is that a client might originally have had a traumatic injury, but for whatever reason, whether it wasn't they weren't able to access outpatient services, or because they lived too far away from the hospital, or they were lost to follow-up, or there were no therapists in that area that have that scope of practice. I'm noticing that I see this patient much further down their injury timeline. So they initially, again, they had a hand trauma and they were managed either surgically or conservatively, sometimes even more conservatively than would be typical. But maybe because that was too difficult to follow up with them, because there's so many patients rurally and not enough doctors. But for whatever reason, they weren't able to access therapy, and it resulted in a stiff and sensitive lower functioning hand and upper extremity. And here are some examples of splints that a hand therapist could make customly. So they're made out of different materials, they have different thicknesses to them and weights, and there are different patterns that a hand therapist could use depending on the injury. So on the top we have a short thumb spica that could be used for someone with a skier's thumb, someone with thumb arthritis, or a median nerve injury. On the right with the pink Velcro, we have a resting wrist splint, which could be used for when someone is newly diagnosed with carpal tunnel before surgery, or for someone with a TFCC, or like that wrist complex, that disc that's in the inside of the wrist, injuries like that. On the bottom left, there is an ulnar gutter for someone with maybe a boxer's fracture, but allows for joints that are way above the injury and below the injury to be able to move, so that it decreased the risk of stiffness in the other parts of the hand and wrist. On the bottom is actually one that I made myself in the middle for a patient that has a bad distal elbow fracture, so distal humerus fracture that needed some help with her bending. So it's a static progressive elbow brace. And on the bottom right, we have a custom oval 8. Which could be used for someone that has a swan neck deformity. Luckily, all of these splints have an off-the-shelf or over-the-counter or prefabricated option. One size, unfortunately, generally fits some, but in the absence of custom, these options can be suitable depending on the injury. Part 3 is going to be on how virtual hand therapy can help. You might be asking, how will we be able to do a lot of these things in a virtual setting with the absence of having a physical assessment and being able to feel how a patient's hand or finger or wrist might feel? There's going to be some limitations for what we're going to be able to do, but if you look at this slide here, according to HTCC's website, there are currently 243 hand therapists in Canada. 110 of them are in BC. This number includes the newest therapists who have passed the most recent SCORED exam, but also includes therapists who have since retired or moved on from the profession. On this list, I know at least 5 therapists who are no longer practicing, so this number should be a little bit less given the information. Outside of the Lower Mainland, so we're talking Vancouver, Vancouver Island, Lower Mainland, Kamloops, the Okanagan, there are not very many hand therapists who service the northern or rural areas of BC. There's actually only 10 hand therapists to service all of the rural and northern communities, and not all of them offer custom splinting. The most northern hand therapists are in Prince George. So that's a lot of area after Prince George that doesn't have access. So what we can offer virtually is going to be similar to an in-person session, but with some modifications. So there would be a thorough subjective assessment, a modified objective assessment, and as an example, there's a few special tests that are done in orthopedics that can be done by patients themselves, such as Finkelstein's for de Quervain's, or a Tunnel's for carpal tunnel or cubital tunnel syndrome. And we could modify some tests like Mills or Cozen's for lateral tennis elbow identification, And then there's going to be some patient education regarding their injury, their timeline of healing, their expectations of rehab and recovery, their exercise management, pain, swelling, and wound management that can all be done relatively effectively over telehealth. And while those prefabricated splints aren't perfect, I've managed to find quite a few online that would be able to do a decent job. Again, there's going to be some limitations to assessment and treatment, but I think with my role in InReach, my goal is to be able to reach patients who would not otherwise have access to a practitioner that would be able to manage their injury adequately. I'm hoping that providing some education and management strategies virtually is going to be better than the alternative of no treatment or limited expertise treatment. So as part of their treatment plan, we can work with their family physician to provide maybe alternative routes of treatment that could include physiotherapists that are in the communities or nearby communities of that patient, that they might need that hands-on treatment or that hands-on assessment should there be some limitations virtually. Okay, so here we have a recent case study of mine. We have a 32-year-old active male. He fell down the stairs and onto his dominant hand about 7 days before having an assessment with me. He reported pain on that pinky side or that ulnar side of the wrist and throughout the back of the wrist. Had some mild swelling locally on that back of the wrist and reduced range of motion, particularly with bringing the wrist back and bringing the wrist to the pinky side. Pain with weight bearing, but he was able to perform physical tasks at home and reduced his general activity because of pain, but he was improving slowly. He just wanted to make sure that he didn't have to go see a doctor or get an x-ray. His range of motion, as we can see here on this next slide, is a bit limited, especially again in that pinky direction or bringing the wrist back. But he had mild swelling across his wrist, especially on that pinky side. He had a positive fovea sign, which is if you push into this divot area on that pinky side of the wrist, a positive TFCC grind or compression test that he was able to perform on himself with instructions from me. He was only able to weight bear on a weight scale 50 pounds on that right dominant hand, on his hands and knees, so in that 4-point kneel position with the scale in front of him, compared to 130 pounds on his left side or his unaffected side. His carpal bones weren't tender, especially his scaphoid, and he didn't have any positive signs that would indicate a DRUJ injury or involvement of that ECU sheath or the area that is part of a TFCC injury. So what did I come up with? His pain is mainly in the ulnar deviation direction or that pinky side direction with weight bearing and with kind of that end range straightening or bringing the wrist back, some rotation. He had no symptoms of clicking or clunking or instability. He had no gross amount of swelling, so it made me believe that he probably didn't have a fracture, and there was no tenderness in those involved areas anyway, and it was generally kind of getting better. His swelling was less. He didn't have any imaging, no x-rays or an ultrasound, but signs and symptoms suggested he had some TFCC involvement that was mild, but subjectively improving. So what did we come up with for a treatment plan? I advised him to modify his activities for 6 weeks, at least, so that it would give rest to that area. I gave him some education on the nature of his injury and what that TFCC disc is and how it's important, a timeline of his healing in general, just from like 6 weeks to 3 months to 6 months, expectations of rehab and recovery, his expectations of what he would feel while he was going through his rehab. I advised him on pain and swelling management techniques to avoid weight bearing or painful movements that would increase that inflammation or that pain and prolong his injury timeline. And I advised him to acquire a wrist widget, which is a soft brace for support and have some pain relief. When I saw him again for a 6-week follow-up, he subjectively had improved quite a bit. He had minimal pain and only with weight bearing, but he had tried to do some push-ups, which I would say was a bit too soon for him, given the nature of the injury, and that weight bearing usually comes last. He continued to wear the wrist widget for challenging tasks, but he had returned to full duties at work and at the gym and just wasn't playing sports at this time. He had full range of motion, but his end range was a little bit limited still, and he had mild swelling, very mild swelling compared to what was before. So in summary, hand therapists specialize in the management of upper extremity and hand injuries. We work closely with hand surgeons to treat their conservative and surgically managed patients. There are very few hand therapists in rural and northern areas of BC, but we can bridge this gap with telehealth and with InReach to help clients who would otherwise not have access to these services. So thank you very much for your time and attention, and I look forward to possibly working with you in the future. I'll leave my email below in case you have any questions about hand therapy and if you have patients or you are a patient that could potentially benefit from this service. Great, thanks so much.